This is Rachel Miller. I am doing eating disorders, anorexia nervosa. Uh, Please be patient with me because some of the names from the original people who came up with anorexia nervosa is a little bit difficult to say, so please be patient with me. But here we go. So, the history of anorexia nervosa. Richard Morton noted Theseus Nervosa between 1637 and 1689. And then Harvey shares that the term anorexia nervosa was formally derived in 1873 to 1874 by Sir William Withy Gall, a physician to Queen Victoria. Gall replaced the original term anorexia histica, I think that's how you say it, histica, which was published by Ernest Charles. I have a really hard time saying that. I think it's French, so I think you pronounce it Lasgu or something like that. I'm so sorry. But he is of France, noting that anorexia was due to physiological rather than physical causes, or I'm sorry, psychological rather than physical causes. So, anorexia nervosa in the DSM-5 TR, the diagnostic criteria is restriction of energy intake relative to requirements, leading to a significantly low body weight in the context of age, sex, developmental trajectory, and physical health. Significantly low weight is defined as a weight that is less than minimally normal, or for children and adolescents, less than minimally expected. Criteria B, intense fear of gaining weight or becoming fat, or persistent behavior that interferes with weight gain even though at a significantly low weight. Criteria C, disturbance in the way in which one's body weight or shape is experienced, undue influence of body weight or shape on self-evaluation, or persistent lack of recognition of the seriousness of the current low body weight. Anorexia nervosa in the DSM-5 TR continued. The current severity of that is the minimum level of severity is based for adults on current body mass index, the BMI, or for children and adolescents on BMI percentile. The ranges below are derived from World Health Organization categories for thinness in adults. For children and adolescents, the corresponding BMI percentile should be used. The level of severity may be increased to reflect clinical symptoms, the degree of functional disability, and need for supervision. So you have mild, moderate, severe, and extreme. These are all based off of BMIs for children and adolescents and adults as well. I'm not real sure of the differential of that. This is just what the DSM-5 TR listed. And then next we have anorexia nervosa's impact on the body and mood. So amenorrhea in women, abdominal pain, cold intolerance, lethargy. They might have excess energy, dental problems, and poor wound healing. On the mind and the mood is anxiety, depression, suicidal ideation, and then substance use disorders are very common. Some indicators and warning signs that you could see with someone that may be experiencing anorexia nervosa is food avoidance, picky or selective eating. We have people that are super picky eaters in general, but you can kind of tell when someone is extremely picky or selective when they eat certain meals. And then a fear of gaining weight. And a lot of people that struggle with anorexia nervosa have a very poor self-image. Diversity factors within anorexia nervosa. So an estimated 9% of the U.S. population, or 28.8 million Americans, will have an eating disorder in their lifetime. Anorexia has the highest case mortality rate and the second highest crude mortality rate of any mental illness. Black, Indigenous, and people of color Patients with eating and weight concerns are significantly less likely to be asked about eating disorder symptoms by their doctors than non-minority patients. And then Asian American college students report higher rates of restriction compared with their white peers and higher rates of purging, muscle building, and cognitive restraint than their white or non-Asian, black, indigenous, or people of color peers. Members of the LGBTQ plus community are at a higher risk of having an eating disorder than heterosexual people, and over 70% of people with eating disorders also have other conditions. So most commonly they have anxiety and a possible mood disorder. Therapeutic approaches to anorexia nervosa. Some family therapy approaches is the evidence-based for family approach treatment of anorexia nervosa still remains relatively small. However, many recent moderate-sized trials have been performed. However, there is still insufficient evidence to support the findings that family approach therapy is more effective than other treatment options. The finding in this journal article discusses the different benefits of a family therapy approach that could be beneficial and effective when working with individuals who have anorexia nervosa. And then the findings are based on 2 trials that included a smaller number of participants, and both had problems with potential bias. Findings did show that there is insufficient evidence to determine if one form of family therapy is more effective than the other. Another article I found was the approach to anorexia nervosa and atypical anorexia nervosa in adolescents. Atypical anorexia nervosa can have serious negative effects on individuals who struggle with anorexia. This article also discussed how during the COVID-19 pandemic, an increase in eating disorders in adolescents was noticed. Primary care providers are in an optimal position to screen for, diagnose, and treat these illnesses. The clinical review showed significant screenings for adolescents, and the term atypical anorexia nervosa is used to describe an individual with a history of living in a larger body who becomes preoccupied with weight or shape and loses a considerable amount of weight, but nonetheless remains in a range considered healthy. So an example was dropping from the 95th percentile to the 50th percentile. And then my third article that I had is the rapid refeeding in anorexia nervosa, a dialectical balance. The program is comprised of an interprofessional team, including psychiatrists, psychologists, dietitians, registered nurses, social workers, and occupational therapists, and a dietitian that has specialized training and interest in eating disorders. These patients were referred to the program or seen in consideration by a psychiatrist or a psychologist and diagnosed with anorexia nervosa, including subtype using a structured clinical interview according to the DSM-5. Well, this one says 4 or 5 criteria, depending on the year they were assessed. So the primary objectives of treatment and nutritional rehabilitation, normalization of eating habits, and weight gain to a BMI of at least 19.5 kilograms per metric, medical stabilization, cessation of eating disorder symptoms, enhancement of cognition and skills. The Eating Disorders Program at Credit Valley Hospital is a structured, evidence-based program that is grounded in best practice guidelines. I found this article really interesting in the fact that the primary aims of the study were to examine the effect of institutional change in refeeding protocol on the rate of weight gain and length of stay in the inpatient and day program. Second aims of the study were to look at safety indicators such as electrolyte disturbances and supplementation, refeeding syndrome, transfer to an internal medical ward, deaths, and completion of the program. Treatment is primarily group-based with a strong emphasis on CBT and DBT therapy. So with treatment locations, where I reside in the tri-state area, it's a very rural community. There's not very many that I could find local I couldn't find anywhere local, to be exact. So you would have to travel for treatment. But two of the really good treatment facilities that I did find, with about a 2 and 3 hour commute, was the Louisville Center for Eating Disorders, which is a 3 hour commute from where I reside. And then I've listed the address, the phone number, fax, email, and the website. And I chose the Louisville Center for Eating Disorders due to the good reviews from previous clients. However, some negative reviews stated you must be rich, young, and white to be admitted. This was very disheartening, and I hate that this client went through this experience. I did notice, looking at the reviews, that the Louisville Center of Eating Disorders did comment on that specific person's review and offered them to reach out so they can make some kind of recommendation or fix for the negative experience that they did have. But some of the positive reviews shared the quality of the IOP that was offered there, and their evidence-based practices are genuine and provide the highest quality of care. The second treatment location that I put was Eating Recovery Center of Cincinnati, which is about a 2 hour commute from my residence. I've listed the address, phone, email, and the website, and I chose the Eating Recovery Center located in Cincinnati, Ohio, due to the positive reviews from previous clients. However, I did find one negative review that stated, "Don't take your own medicine like they ask, you won't get it back. This place is an absolute joke, and every right has been violated with this place." Again, this is also hard to hear because you have good and bad everywhere. I did appreciate the fact that there were positive reviews from this facility too, and the same, some people from this specific treatment location reached out to this client too, offering support and willingness to make amends and make something right from what happened to them. Positive reviews were, though, the quality of the IOP and the treatment programs that they offered, with the staff who are deeply compassionate, respectful, and committed to clients. And then here is a list of my references that I used. I really did enjoy researching more about anorexia nervosa and eating disorders in general. We're so used to, a lot of us, working with substance use disorders, but I think eating disorders is a very challenging, but also something that we need to understand and be more empathetic towards, and willing to work with in the social work field. So I'm really glad that I chose this topic, and I hope that you guys learned a little bit from this too. And if you have any questions or comments or concerns, please reach out to me. Thank you so much for joining along. Have a good evening.